There's some of you believe that once that person starts massaging that patient's leg, that stroke is going to go, but it's not true. It doesn't go. I know they've told you that it goes, but I'll tell you why it doesn't go. Because massage alone does not cure paralysis. Why? At best, what massage will do is to allow blood to flow to that area better. But the problem is that stroke doesn't happen because blood was not going to that area. Stroke happened because blood was not going to the brain. So it's the brain that controls that area. And because the brain didn't receive enough blood, stroke happened. Do you understand? So now you see that if you are massaging that area, that's not even where the problem happened. The problem happened here.
It's okay.
So how do you teach the brain how to control that area again? That's what the person should have been doing. But because he's not a trained professional, he doesn't know. He's busy massaging, stretching.
Oh my God!
So here are 5 myths, or rather 10 myths about stroke rehabilitation or neuro rehabilitation that people don't know.
Let's have it.
Number 1 myth is that once you start physiotherapy, that you never stop. That's not true. Because physiotherapy is not an endless activity. It is rehabilitation with clear goals. When you were with your physiotherapist, you people set some goals and time frame to achieve those goals. If you didn't set time frame, ask him and tell him, when is this supposed to end?
Yes, that's correct.
After that goal or those goals have been achieved, he discharges you and you're free to go, or he will reduce this number of sessions or visits. You see? That is the way it is done. So physiotherapy is not a lifelong something, except for maybe conditions that are progressive, like Parkinsonism or MS, multiple sclerosis, like that. Those ones, it's as if the condition doesn't have cure. So the physiotherapist needs to keep managing you so that you manage your symptoms well. Number 2 myth is that massage alone can cure stroke or paralysis.
Use your head, my friend.
I've told you already that it is not true, because stroke affects the brain, not just the muscles. In fact, it affects the muscles because the brain has been affected already. So the real stroke actually happened in the brain. And because the brain is what controls the movement of the hands and legs and all. So if that part of the brain is affected, the part it controls will also be affected. That's why the hands and legs are affected. What physiotherapists do, they use exercise, guided exercises, to retrain the brain on how to perform those functions, because the brain actually has the ability to do that. Number 3 myth is hot water cures joint pain.
If you want to talk to me direct. Don't go through the corners.
Many times people have joint pain and the next thing they use hot water and put it there. First of all, you can even burn that place. Secondly, you are not controlling the temperature of that hot water.
Let's have it.
The truth is, controlled thermotherapy can relieve stiffness and pain when you use it safely. But that alone is not enough. You need both exercise, which is duration based, and controlled thermotherapy. Wow! You need to control the temperature of that water you are using. Myth number 4 is that once a patient has started walking, it means you are healed. No, many people recover from stroke and they are walking one kind. That's not full recovery. Recovery continues even after walking has begun.
What?
Physiotherapists need to improve the quality of the walking, the gait, the strength of the patient, the confidence of the patient, so that he doesn't fall down after he has started walking.
It's okay.
Myth number 5 is that children with bow leg will outgrow it. Nah. You see, some mild bowing or bow leg is normal in toddlers, but not all of them resolve with age. Exactly. If there is muscle imbalance, if there are some other conditions which the doctor will be able to assess and find out, the orthopedist or the physiotherapist, it will prevent deformity progression. You see, they will need to do strengthening, bracing, correct nutrition, and such interventions. That's the best way to go about it.
Don't cry.
Myth number 6 is that stroke is caused by evil spirits. I feel like rolling my eyes.
How?
Guys, do you go ahead saying that malaria is caused by evil spirits? No. Then why is stroke different? Stroke is literally that blood is not going to the brain. That's the response. The result is what you see as stroke. And sadly, people go about the religious cure when they should have rushed the patient to the hospital so that they can get oxygen to the brain as fast as possible.
Hey, God.
You see, because if you do that within the first few hours, you can help that brain tissue. But nah, so it's not demon, it's the brain. Myth number 7, that you can rub anointing oil or oil on a paralyzed limb and it will start working.
Do me a favor, please. Get out of here. Get out of here.
Yeah, well, oil doesn't reconnect damaged neural pathways or restore muscle control. It may soothe the skin, it may feel good, but it has no therapeutic effect on paralysis. Precious recovery time that should be used to rush the patient to the hospital, they use it on religious rituals. Because the thing that happened is primarily in the brain and spinal cord. Do you understand? Yeah, faith is good. I believe in faith to provide emotional support. But if you combine physiotherapy primarily and faith, you get the best results. Then myth number 8 is that a bone fracture heals faster when you apply native herbs and tie it tightly. I mean,
Shut up, you. Shut up.
It's not true, because even that tight tying can cut off the blood supply and cause what we call gangrene or deformity. That leg, they may end up cutting it off because you cut off the blood flow. So fractures need proper alignment. They need to arrange the bone that's scattered and immobilize it, keep it one place so they can join. And then physiotherapists will now strengthen the leg again, help with the joint movement, and help as the healing takes place and all. Do you understand? So traditional remedies without medical guidance is dangerous. And myth number 9 is that pain always means that something is seriously wrong. It's not true. Pain can exist without any structural damage.
Are you kidding me?
For instance, chronic pain syndromes, it sometimes is caused by overreactive nerves. You get nerves where they react too much. Fearing pain too much even makes it worse psychologically. So pain is a warning signal, but not always a sign of severe injury. All right. So sometimes physiotherapists may teach pain management, movement re-education and relaxation, and helping you to relax, because typically when you understand why you're having pain and when you relax, the pain tends to go down. And then the last one, myth number 10, is the fact you are not feeling pain means you are completely healed. That's not true, especially for people with back pain. You've been doing physiotherapy for 2 months or 1 month and your back pain is gone. I beg, stick with the physiotherapist's treatment plan and duration. Why? Because healing is confirmed by function, not just the absence of pain. You understand? So physiotherapy ensures proper movement patterns and strength balance. Pain-free does not always mean problem-free. Finish the treatment, finish the exercises so that you will really solve all the problems from the root cause. All right, so if you've not subscribed, do well to hit that subscribe button. If you've not liked this video, do well to like it, and I will talk to you soon. If you know what you want me to talk about next, put it in the comment section and I will see you soon. Ciao.